Thank you, Catherine. Lovely to see you. And as she said, it's been a riotous few days here, so I appreciate everybody coming out. Maybe your lives are not as affected as ours. I personally wouldn't mind writing in a draft for Catherine for Conservative leader. They seem to be looking for one. But we are talking today about health. And as Catherine said, we would like you to pull out your devices. You don't have to furtively check your iPads or phones. We do want you to take part in this. What this segment here is a lively conversation on some questions that we're going to talk to you about, and then we will ask these guys to have some words about it, and then we'll come back to you and see what the result is. So, I should introduce the panel. Pardon me. With me today are Bill Tholl, who calls himself a recovering CEO for a number of healthcare organizations, Canadian Medical Association, Healthcare Canada. Dr. Geneviève Moineau, and I'm going to have to read, the President and CEO of the Association of Faculties of Medicine Canada. And Peter Cleary, who's a senior consultant with Santis Canada. So they're going to field some questions, so are you. And our first one is a really broad, open-ended question. Is health an important priority for this government? Bill, you have some thoughts on this?
Well, thank you for the invitation to be here, Susan. Thanks for the question. I guess my first crack at this would be there were 364 campaign commitments in the last federal election, and 4 of them have been identified as specifically pertaining to health and healthcare. We're halfway through the mandate. Government's done a lot, starting with restoring health benefits for refugees and immigrants. We'll maybe come back to this. There's a tick in the health accord box. But as Catherine's already mentioned, Canadians continue to be worried about health and healthcare, particularly as it relates to care and support for our loved ones, our senior loved ones, particularly those with disabilities and frailty and so forth. And twice as many Canadians are worried about healthcare, for example, as are worried about terrorism. So as much as that's been done by the government so far, and it's nice to see a federal government that's got an activist agenda again with respect to healthcare. It's been a long time since we've had that. So as much as they've been doing, there's a lot more that needs to be done.
Geneviève, do you have thoughts on this?
Thank you. I agree that there continues to be much to be done. However, I do believe that this government has tackled some very important issues for Canadians, including the medical assistance in dying, the opioid crisis, and others are still in the works. And so I do believe this is a good start. There is much more work to be done, and we all have to take our part in supporting the government in its work.
Peter?
I like open-ended questions because I can say yes, but.
Okay.
So when I worked in government, I always hated really quiet days in government because health was always an issue when something else wasn't happening in government. Health is always important to people, and people are quiet when it works well. And a quiet day in government was always worrisome when you're an issues guy in health because you just know something's going to come up, something's going to impact you. And even though the government does care about it, I think you referenced a couple really important signature things that have been happening, it really ebbs and flows when it's actually in the media and in the minds of Canadians. And it usually only happens when something is going wrong, but when it's working well, it's quite quiet.
Have you seen a change with the new minister? Like, has the priority moved up or down with the change of minister? Because I'm not sure Canadians know. There have been very few shuffles, but Bill, have you seen a change?
I think the big factor in terms of looking at the shift in ministers, I think everybody felt that Minister Philpott did a pretty good job. I call her a minister for health, not just a minister of health, and she understood it. As a physician, she got it.
Yeah.
I think with the transfer of the First Nations Inuit Health Branch from Health Canada to a separate ministry, which again has been called for some time by the Indigenous leaders, I think that's a big game changer for Health Canada, and the role of the new Minister of Health is going to have to be redefined hopefully to make room for other issues.
Yeah.
And Jenny has already mentioned the opioid crisis. It's not done,
Yeah.
right? Marijuana, it's not done. So I think we're all looking forward to working with Minister Pettibot Taylor to pick up where Minister Philpott left off.
You guys have thoughts on that?
Yeah, I think it is clear that those dossiers that have been started continue. I think that with Minister Pettibot Taylor at the helm, there will now be a focus on mental health and addictions, as there should be. I think where we are all waiting with bated breath to hear the commitments in the federal budget for 2018 is on health research.
Yeah.
We know that research is one of the best ways to ensure the health of a population. Without the support for the research in Canada, Canada will fall behind not only in the health of Canadians, but also in our economy.
Peter, just...
I think Minister Pettibot Taylor has an easier job in certain respect that three of the $4 billion of her department is now in somebody else's department. The focus that you can put on a lot of these things that have been mentioned already is allows you to actually focus on those a little bit more. But the one thing that I think is going to really crop up, if we're talking about the ebb and the flow, I think pharmacare is something that's going to start taking up a lot of the time of the government. We have an MP here sits on the committee. We're anticipating a report on that. We've had moves from Ontario, and it's just a logical big policy that the new federal minister will have to take on.
Interesting. Okay, we're going to go to the next question. Has the government put an appropriate public health lens on the legalization of cannabis? Again, cannabis is such a huge issue. We often don't think of it as simply a health issue. It's a law issue. It's a recreational issue. Peter, do you have some thoughts on this?
Sure. I think one of the whole reasons the government decided to make a decision on it was for public health reasons. That doesn't mean, though, that there doesn't need to be key investments in actual public health campaigns. I don't think anybody would debate that cannabis isn't. It's not like anybody's out there saying cannabis is a good product for you to have. I mean, nor is alcohol. But it's a different world that we're operating in, because at the same time you don't want to stigmatize a group that actually need it for medicinal reasons. So it's incredibly complex. The whole reason is for public health reasons, I think. But there also, and I know the government's already committed to doing it, but there also needs to be some campaigns to back that up on public health.
Geneviève?
I would agree with Peter. This is an important topic. Physicians are very concerned about the rollout, because there's clear evidence that use of cannabis has a significant effect on the developing brain. So 13 to 24-year-olds who are often the users will potentially have detrimental effects, and this affects their academic performance, and also can lead to early onset psychosis, and this has been really well proven. So what we need to do is we need to really enhance the campaign to inform the public on these risks. There's been some great work done by some provinces, particularly Nova Scotia, to actually start this campaign, and I think that all provinces need to ensure that they are properly informing their populations prior to the onset of legalization.
Thanks. Bill, do you think...
Yeah, just two additional
Yeah.
points. Again, I echo that it's an important issue. It's a public health issue. It should be looked at through the lens of a public health harm reduction strategy rather than through other lenses. Two additional points, though. One is it's a drug, right? And do we know everything that we need to know about the administration of this drug, its counterindications and so forth? And I think it's going to really require strong post-market surveillance once we have marijuana legislation in place, number one. And number two, where do we allow the most frequent way of using marijuana is inhaling it? What does it mean in terms of everything from allowing smoking in rental accommodations through to including in hospitals where medicinal use of marijuana is going to be used? So there are some issues there in terms of its use.
Yeah, do you think the public is seeing it through a public health lens? Or is it?
Well, it should. And I think, the other area that we really have very little information and control of is the use of marijuana in schools, the use of marijuana or cannabis by individuals who then will get into a car and drive. And we know that there are significant effects there, and the public in general does not realize that.
Thanks for saving Bill and I there. But I think July 1st, it's a date that is in people's mind, well, maybe not July 1st, whenever it is in July 2018, it is in people's minds, but that really is still just the beginning. When you look at the complexities of distribution with recreational, then there's still going to be some complexities as the medical system evolves, especially how people will maintain having priority access in the medicinal system. This conversation is really just starting.
Okay, let's see what the audience says. And again, I'm going to need a volunteer to read out the sign because I am not hooked in on my... What's that? 48 yes. Wow. Again, this is a very seriously divided audience.
These
Interesting.
are good questions.
Yeah. All right, our third question is, are we doing enough for Indigenous health? And often this seems like a question we're asking ourselves more and more, I think rightly, on Parliament Hill. Geneviève, what do you think?
I would say not yet.
Yeah.
I would say the government has clearly indicated its commitment. I think the recent changes in the creation of a Ministry of Indigenous Services led by Minister Philpott, who obviously is a very effective minister, are important steps. And her focus on the social determinants of health as a first step are crucial. And so the ability of our Indigenous populations on reserve to have clean water, to have appropriate housing, those are the most important initial steps in moving towards equity in health and health services. And so I'm encouraged by those first steps. Much more has to be done, but I believe she actually is the woman to get the job done.
There was an interesting moment last week, meeting with the Métis leader, Chartrand, said that he thinks that actually Indigenous health is being improved by the fact that two women, it's sort of a collision of the Me Too movement and the division of Indigenous affairs has actually may change things for the better. Would you agree with that?
Yeah, and you know what, I think...
no choice.
Basically, you're surrounded.
But I think if you had somebody from the government here and you asked them that question, I think, and I would hope they would probably say no, only because the amount that the government's doing in such a condensed period of time is nothing short of incredible in collaboration with partners across Canada. But is it going to solve reconciliation in the next 2 years? No. And I think the answer needs to be no, only to keep pressure on the government and everybody else involved to get this right.
That's a good... I foresee polarization on this one too. Bill, what do you think?
Well, back to the original question, I don't think it's possible to do enough to address Indigenous health and Indigenous health inequalities. The numbers are staggering in terms of infant mortality rate differentials, life expectancy differentials, and suicide differentials. So I don't think it's, point number one, I don't think it's possible to do enough. Number one. Two, I don't think governments can do it on their own. It's going to take a full court press, right from the regional health authorities that I used to represent and the Doctors of Canada. It's going to take a full court press. And third, it's going to take a complete change in the approach. It's going to have to be by First Nations, for First Nations. It's got to be owned by Indigenous leaders. And the good news is we've got a whole new crop of Indigenous health leaders that know how to get it done. Almost need to get out of the way.
All right, let's see what the audience thinks. And I now have a screen in front of me. Thank you very much. The polarization has ended. It's 92% saying, no, we are not doing enough. But as you say, that could even be good news. It's a sign that keep the fire lit underneath them. Do we have time to get to the fourth question? Yes. Okay, good. We were hoping about this. I think in the government's mandate tracker, everybody's familiar with that, it calls the promise to get health accord with the provinces fully met or Yeah,
Completed.
fully met and completed. And that is because there are individual deals it made with the provinces all in, over the course of the past year. So our question is, do you agree that it can, that this can be called fully met or complete, that the federal government has reached an accord? Peter, why don't you start?
Sure. Well, I think, go back to when we saw the federal government and provinces sign a 6% escalator with no strings attached. There's some serious challenges in the healthcare sector at that point in time. You had chronic underfunding, low salaries. You also need a federal government to have a stake in the game when it comes to provincial healthcare delivery. Fast forward, we are in a different state in the healthcare system. You had a federal government and provinces that knew that these were two priorities that needed to be addressed. So the answer is yes, they did achieve what they said they were going to do. There will always be questions if it was enough money. But what I think it does is it sets a template for how the federal government can provide funding to provinces based on priorities. It got them out of that 6% escalator, no strings realm that they were in, and we now have a new template to solve whatever future problems, maybe it's pharmacare, maybe it's something else, that the federal government and provinces see fit.
What do you think, Jennifer?
And no, I agree. This obviously was not the accord that the federal government hoped for initially. But I think considering the circumstance, they got as far as they could get. And I think, as was described, the important aspect now is that there is accountability where there was very little before. And I think that was an important hurdle to jump over. And I think it's set us up for a much healthier interaction in the future.
Bill, what do you think?
Well, I think it's a stretch to put a check mark opposite health accord.
Yeah.
It's not the health accord that was promised. What was promised was a multilateral accord delivered in the spirit of sunny ways, right? I think this is more an example of bond cop, bad cop, in terms of the Minister of Finance defending the till and the Minister of Health doing a good job of buying change this time as opposed to just buying peace with the provinces. So I think it's too early to tell. There's a series of bilateral agreements that have to be followed up with each of the provinces and territories. Only 2 have signed on in terms of common indicators, Newfoundland and Labrador and New Brunswick. So I think there's a lot left to do, but the 2 key areas that they're focusing in on, home care, right, community care, and Jenny's already mentioned it, mental health and addictions. If you ask Canadians what are they most worried about, those are 2 areas that they're most worried about. So Godspeed in terms of addressing those 2. But back to Peter's point, is there enough money? $11.5 billion over 10 years, spread over 13 jurisdictions. Somebody from Alberta said that covers 15 minutes of the running costs of the Alberta Health Services program.
I know you've all mentioned it before. Do you think health is going to be a big deal in the budget?
I think we saw a significant commitment, the 11 billion plus in previous budgets. So I don't think it will be a health budget because I think there was a significant amount in previous budgets, but to be seen.
We're now going to go to the results of. Oh, Bill, did you want to say something? Yeah.
I'm going to disagree with Peter on that. This better be a health budget in 2 respects.
Yeah.
One, CIHR, as Jenny's already mentioned, they took a time out last year, nothing to CIHR last year. And unless we start to reinvest in particularly our researchers of the future,
Yeah, that's a
we're going
good
to be left
point.
high and dry. Point number 1. Point number 2, infrastructure. It continues to be dialed out in terms of federal investments in the very institutions that they help build.
You had some.
I would concur there. As I say, we're all waiting for, with bated breath, to see a significant level of support for health research, support the report. And I'm hopeful that there will be some influx of funding as well to support our work on Indigenous health, because that's what it's going to need.
Well, that was me slipping in another question there secretly, not so secretly. So thank you all for participating in this. The results of the last one are, again, we seem to be moving all more of as a group. No is the answer, with the idea that the government can say that the fully met obligation.